I think everyone who has thought about doing medicine before has, or even gone into medicine now, has thought about doing surgery. I think that is obvious. If you say you've never thought about doing surgery one time, you're clearly lying to me because surgery is, let's be honest, it's pretty cool when you think about it, in theory. And this is from someone who's actually never watched Grey's Anatomy. I've never seen the show beforehand. I never got the all hype and the ongoing storyline, the characters, none of that. But surgery objectively is pretty cool. You know what I mean? Like you're actually like using your hands and different tools to really like I guess in a way cut open people and fix them. You know, it's awesome. It sounds like it's just cool. Like remember those games that you played when you were a kid, like the doctor games, when you have to like I don't know what the game was called, but you had to like piece people together and like find different parts of the body, etc. That's kind of what surgery felt like. The only thing is the reality of surgery is that it wasn't an enjoyable experience for me. I'll be honest with you. Like, and when I say it wasn't an enjoyable experience, I'm not talking about the surgery itself. Now, surgery itself, like when I'm in the OR and I'm in my sterile gown and I'm gonna have my gloved up and I'm like, doing stuff or whatever, it was actually fun. It was exciting. It was like, oh wow, if I move to the left a little too much, this patient might code. It is fun. I'm joking, but it was interesting because you're using your hands, you're using tools, and you're fixing people. And then, after surgery, you can sometimes even see the immediate results of whatever the work you just did versus you doing something like internal medicine, family medicine, which is more like long term. And so surgery is very appealing. The only issue is the actual lifestyle and what happens beyond the scenes or outside the scope of the OR might not be the funnest thing. I know you know that or I know you've heard that surgery has the propensity to be very toxic, and it's true. At least in my experience, I've when I was doing my surgery rotation as a medical student, the surgeons, the way they talk to some of the students or some of the other residents, even some of the other physicians, really wasn't really the nicest. And like I get it, it's like a high stress, high strung, field of medicine, but it doesn't hurt you to be nice or talk to somebody with at least a little decency, a little bit of respect. Personally, I wasn't necessarily disrespected during my surgical rotation. Was I made to feel like, a little dumb? Definitely. But overall, it wasn't, I can definitely say that my friends have had it a lot worse than I did, unfortunately. But back to my rotation, like the rotation was brutal. Like surgery, I think our surgery rotation was from 6 to 6, if I'm not mistaken. So you were expected to be there before 6 o'clock every day, and you expected that you could leave no earlier than 6 p.m. every single day throughout the entire rotation. And it was just that, and that was 6 days a week. So the toll of you having to be there for 12 hours every single day, 6 days a week, and it was just a lot, especially for me as a medical student when I didn't sign up for surgery. I just have to take that rotation. And then the thing about surgery too is that if I would say my surgery rotation, say I'm spending 12 hours, on a surgical day, right? And a day on my surgery rotation, how many hours am I actually in the OR operating on a patient doing the cool stuff? I would say maybe, depending on what surgery, of course, like 2 to 4 hours, not even, maybe, yeah. I would say about 2 to 4 hours, maybe, including like, the prep, getting sterile, clearing up the area, cleaning the body, blah, 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 about 2 to 4 hours. So the bulk of my day actually isn't really necessarily in the OR. As a medical student, at least, it was not. And obviously, there were some rotations where I spent like 6, 7 hours in the OR. But for the most part, I was spending about 2 to 4 hours. And I feel like it might be even different if you're actually a surgical resident versus a medical student. So I'm only doing the cool part of surgery for like 2 to 4 hours a day. And then as a medical student, I wasn't even like really cutting into anything or doing nothing crazy. I was really just pulling or retracting or holding something for the attending or the actual resident. And so I didn't really enjoy that portion. The rest of the time with surgery, I'm like checking in on patients, doing pre-op stuff, asking certain questions, getting history, explaining like consent forms, just being just being around, really. I felt like a lot of surgery was just me being around. And then the times where I'm not able to be in the OR with the attendings or the other residents, I'm kind of just watching them. And that part to me was probably the most frustrating because I don't think I was learning much by just watching them. It was cool had I been able to maybe do something, but as a medical student, there's really not much you can do. You spend a lot of time just standing. You're just standing around. And like I said, sometimes these surgeries can be long. So thankfully, I was only in the 2 to 4 hour surgeries, but there were some surgeries that were taking 6+ hours to do, especially if there was a complication. And the entire time I'm over here standing and I'm fully gowned and I'm just standing like this. So I'm not actually, because you have to keep your hands sterile. You don't want your hands to go below your waist because that breaks sterility. You don't want to accidentally touch something, itch your cap or anything like that because it breaks sterility. So you keep your hands like this to prevent yourself from actually moving. So I'm keeping my hands like this the entire time, just standing like, And the thing is, usually when the surgeons are doing their thing, like, they're hyper focused, because they need to be. There's a person's body on the table and they're not really always they weren't always explaining things to me. So I didn't really know what was going on, to be honest. I mean, obviously they're talking to the resident because they're teaching the resident, but me as the medical student, I'm just like, hey guys, I'm still here. Surgery is taking pretty long. I need to use the bathroom, but I'm not going to be the one to say anything, so I'm just going to mind my business. So it was kind of difficult. But I will say the few times that I actually got the opportunity to actually go into the surgery and actively like do something, like actually whether it's cutting something or retracting something for short periods of time, or just, handing a certain tool in case the OR tech was already busy with something else. Like, it was fun. I can't lie. It was fun. Like, doing an incision was fun. They did allow us to do some of the stitching, so that was pretty cool too. So stitching was, I know some people don't like stitching, but to me, it was like one thing I could actually do as a medical student. I enjoyed it. I would say though, like overall, like, surgery rotation wasn't the best just because it was like long hours, a lot of standing around. My back, lower back. If you're going to do a surgical rotation, prepare yourself for your lower back because you're going to have lower back pain. It's like inevitable. So get some good shoes, do some good stretching before you come into work every single day. I will say there was one exception though. There was one of my surgical rotations which I loved, like absolutely loved it, and it was burns. I was on the burns team, the burns unit, and not because I'm like obsessed with fire, obviously, or nothing like that, but during burns was the most hands-on I was able to get as a medical student. Like, cause we're like, cutting up some skin, peeling off some burns from like the patient's body, dead skins, getting, trying to match cross type, blah, 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 whatever it's called. I can't remember what it's called. It's been so long, but the point is, getting grafts. So basically like, taking skin, peeling, like cutting off skin from one part of the body and applying it to where there was like extensive burns to another area. That was actually not bad. And that's burns is kind of like a surgery where it's like it takes like a whole team to do. You can have one person start trying to graft or take pieces off like certain parts of the body, or you can or peel off like the dead skin from one part of the body, or you can have like a group of people doing it. And so we're each doing our time, take our time. So I was very hands-on and I loved it, to be honest. The OR is extremely hot though. I will say that. Like, I don't remember the degrees, but I just remember coming into work every day. And then when I left, I was like when I left the OR, I was sweating, drenched in sweat. I'm not sure the reason behind it. I can't remember, but you had to keep those OR rooms like really, really hot. It felt like you were in a sauna. That's how hot it was. But it was fun because I actually got to do something. If I see a guy who has like 80% of his body burned and, a lot of it's like dead skin, my attending can be working on this. And, if we're all trying to get all 80% of the dead skin off, the attending might be able to cover like 50% of it. The resident can do 30%. That's 10% of the body for me to kind of take the dead skin off. And then we have to start applying the grafts, and then we're stapling the skin into it, blah, blah, blah. Like, it was fun. Look at that. I'm getting a little excited. It was actually fun for me. So that was cool. There are some surgeries that do like robotic surgeries now. Was I able to actually use the robot? No, but I was able to witness the attending use the robot, and it seemed really cool. So there's some surgeries that you can use robotics where you're literally sitting here, right? Put your eyes into like this machine, and you're like using the controls, and the actual surgical robot is really doing the incisions and everything for you. Did I do anything cool, school surgeries? Well, besides burns, because burns was really fun. I did like, gallbladder surgeries. I did an appendicitis. I did an ectopic pregnancy. That was one that I did. It was one that I really enjoyed. I did like a couple GI surgeries too, but nothing like super, super notable for me at least. Cause I was just so excited to actually do the surgical component for the few hours that I was able to do something. But then when I'm just standing and just like, hands like this and not doing anything, or when I'm just, being like doing grunt work around the hospital, like, hey, I need this, where are the charts for this patient, talk to this patient, explain to them this, call this person, like that part I didn't enjoy. And I felt like that was the bulk of my surgical rotation. If there was like a rotation where all you do was surgery, just procedural skills, whether it's in the actual OR, like using your hands, whether it's just burns, whether it's using the robots, I think I would probably have been a surgeon to this day. But then again, like I said, the lifestyle, the culture of surgery in general, it's tough. It's a tough field. I'll say that. You cannot be weak at heart to do surgery. you have to really enjoy it and really tell yourself, like, you know, whatever goes on, this is where I'm meant to be. This is where I want to be. I can handle this. I can push myself through, and you'll truly enjoy your surgical rotation. I kid you not, because it is fun. And for those who actually want to do surgery and who are in love with the field, they will not rest, because they will feed off that energy, literally. All I can say is that I've noticed that for my friends who are doing surgery, that surgery has become less toxic over the years. So 15, 20 years ago, what was happening will definitely not stand today. But it's like a slow progression, you know. But like I said, these guys, these surgeons, male or female, they are in these high risk situations where, you know, you sneezing can sometimes cause life or death in a patient, depending on what kind of surgery you're doing, especially like the neurological surgeries. And they are long. So be ready, be prepared from that. And I will say, although there's a lot of grunt work and do all this extra stuff that you have to do with surgery outside of the OR, when you become an attending, I think it changes. Like when you finish residency as a surgical resident and you've become an attending, it changes. You can kind of depict how much OR time you want and how much clinic or outside of the OR time you want for yourself. So if you're really into surgery and you really don't want to deal with all the extra stuff outside of it, it's still an opportunity. You just got to get through the medical rotation, get through residency, and you can kind of depict how much time you want to spend actually in the OR. So that's all I have for my surgical rotation. Overall, it wasn't bad rotation, just long, and it was tiring, definitely. But I enjoyed the surgical aspect of the rotation. So if you guys have any questions or comments, drop it down below. I'm always happy to answer it. And stay tuned. Like I said, I'm making videos for all the rotations that I did. So I hope you guys enjoy those videos and check it out too. Thanks.